Country I decided to compare the US healthcare system is to Japan. Now, although we cannot fully compare or adopt other national healthcare systems, we can analyze differences in coverage, financing, and overall services to better our own. The US ranks worst among 11 wealthy nations in terms of efficiency, equity, and outcomes, despite having the world's most expensive healthcare system. The United States ranks at 37 behind countries like Canada, Saudi Arabia, Germany, and many others according to the World Health Organization ranking. The Affordable Care Act, established in 2010, provided access to insurance to millions, although big gaps still exist between insured and the uninsured. About 33 million individuals, or 10.4% of the population, was uninsured in 2014. Japan was the first nation in Asia to establish a universal public health insurance system, which required all citizens to have health insurance. Unlike the US, Japan's insurance plans allows patients to freely choose their own providers and are not limited to a selected few. A system like this not only increases access to care but also increases patient satisfaction. In the US, having a list of providers to choose from is a problem. Depending on your insurance, you can only go to providers within your network, which can reduce one's access to care. The US ranks number 1 in health spending at 17.6 of the GDP, one and a half as much as any other country. Japan has demonstrated that it is possible to have cost containment while maintaining payments to physicians. Japan's total health expenditure amounted to approximately 10% of the GDP in 2013. Japan contains their costs by setting up a common fee schedule to ensure that hospitals, doctors, and health services are paid the same rates for the patients they serve. In the US, the amount a healthcare service gets paid is dependent on the type of insurance a patient has, meaning health services can pick who they want to see to obtain the maximum payment. Japan also does a great job in responding to rising costs in specific areas and intervene by lowering the fees in those services. They monitor how many generic drugs are being prescribed by physicians and can send somebody to encourage the use of cheaper alternatives if necessary. The US, on the other hand, is much less flexible in changing rates. Rates cannot be changed without the approval of Congress, which can slow this process down significantly, making cost containment very difficult to achieve. The average American lives to be 79 compared to Japanese at 83. In the US, adult as well as child obesity rates are one of the highest among other countries. In 2011, over one-third of children in the US were overweight or obese. Japan is rated one of the healthiest nations on the planet. This has to do with their emphasis on preventive care. It seems that the focus in the United States is treatment and not prevention. Obesity, diabetes, kidney disease, heart failure, and a variety of other conditions that are big concerns in the US could be prevented. Preventive care in Japan is part of their culture. Employees are required to conduct annual health screenings for every employee. Dependents are covered by corporate schemes. Those not covered by employers receive screening reminders from the government.